You did everything right and went to an in-network hospital. You asked about costs up front and they said $200, maybe a bit more. Then 3 months later, a bill arrives for $2,000. You feel like you're being pranked. Ever wonder why following all the rules still gets you financially ambushed by a system that's supposed to help you? Today, I'll explain medical billing in America like you're 5 years old. By the end, you'll know why estimates fail, which traps inflate your bill, and how to fight back. Here's what's really going on with medical pricing. Every medical service has 3 completely different prices hiding inside it. First, there's the sticker price, the inflated number the hospital puts on the bill that almost nobody actually pays. We're talking $50 for a single Tylenol, $200 for a bag of saline that costs $1 to make. It's like seeing a couch at a furniture store marked $5,000, knowing they'll take $2,000 because nobody pays sticker. Second, there's the negotiated rate, what your insurance company secretly agreed to pay behind closed doors. This might be 50 to 80% less than the sticker price. You never see this negotiation happen, and you're not invited to that meeting. Third, there's your share, and this is where everything falls apart. Your share depends on your deductible, your copay, and your coinsurance. These are 3 different ways of splitting the bill that somehow all apply at once. If you haven't hit your deductible yet, you pay the full negotiated rate out of pocket. If you have hit it, you might pay 20% as coinsurance. A copay is a flat fee for certain visits, like checkups. Most people have absolutely no idea which bucket they're in on any given day. That $200 estimate was probably someone guessing before they ran your visit through this maze of buckets and percentages. Now let's talk about the traps that turn reasonable estimates into financial nightmares. Trap 1. Out-of-network providers inside in-network hospitals. You go to an in-network hospital for surgery, and you did your homework. You checked everything, you called ahead, you prepared carefully. But the anesthesiologist who put you under? Turns out they're out of network. The pathologist who read your biopsy in some lab 3 states away? Also completely out of network for your insurance. You never met these people and you never chose them. You were literally unconscious when some of them worked on you. And now they're billing you at out-of-network rates, which means higher costs and maybe no insurance coverage at all. It's like ordering a meal at a restaurant that takes your credit card, then learning the salt costs $100 because it's from a different vendor. You go to your doctor's office for a regular checkup. Same doctor, same exam room, same chair you've sat in for 5 years. But the office was recently bought by a hospital system. Now they charge you a facility fee on top of the doctor's visit, sometimes hundreds of dollars. Nothing about your care changed, and you didn't get better treatment. The doctor didn't suddenly go to night school. It's a billing code change, not a medical one. You're paying more for the exact same appointment because someone in accounting found a loophole. Here's where it gets really frustrating with Trap 3. Observation status versus admission. You're in the hospital overnight, lying in a bed, wearing the gown. You're getting IV fluids and medication, just like any other patient. But you're labeled under observation instead of admitted. This isn't a medical decision, it's a billing one. Observation is billed under outpatient rules, which often means higher out-of-pocket costs. It also means no Medicare coverage for follow-up rehab or nursing home care. People have stayed in the hospital for 3 full days and then been told they were never officially admitted. It's like staying at a hotel for 3 nights, but they call it extended lobby sitting, so they can deny you the breakfast buffet. Trap 4. Coding changes inflate bills invisibly. The estimate was based on one procedure code, let's say a simple X-ray. But during the visit, the doctor orders a slightly different angle or a follow-up view. Suddenly, it's billed under a completely different code with a wildly different price. You didn't ask for anything extra or request the deluxe package. The change was invisible to you. The bill is not. It's like ordering a small coffee and they charge you for a large because you asked for extra ice. Trap 5. Prior authorization failures nobody tells you about. Your doctor orders a test or medication. You assume it's approved because your doctor wouldn't order something insurance won't cover, right? Wrong. Insurance required prior authorization that nobody submitted in time, or it was submitted but denied. Now you're on the hook for the full cost because the service was never greenlit. You had zero way of knowing that in real time. You're sitting in the waiting room assuming everything's fine while insurance and the doctor's office play phone tag. By the time you find out, you've already lost. And then there's the deductible reset that catches everyone by surprise. Every January 1st, your deductible starts over from 0. So if you're used to paying $30 copays in December because you finally hit your deductible, that same visit in January might cost $300. You have to climb that mountain all over again. People forget this every single year. It's like a video game where your progress gets erased at midnight on New Year's Eve. You wake up back at level 1 wondering why the same enemies suddenly cost way more to defeat. Here's your survival script for when the next bill arrives. Step 1. Always ask for an itemized bill, not just a summary. Line by line. Every single charge broken down. Hospitals often remove charges when you ask for this because they know you're actually paying attention now. They can't sneak in that $80 box of tissues when you're watching. Step 2. Request the CPT codes. Those are the billing codes that describe exactly what procedure was done. Google them. Make sure they match what actually happened. Billing errors are shockingly common. Sometimes they charge you for things that never occurred. Step 3. Compare your bill to your EOB, the explanation of benefits from your insurance. The bill from the hospital and the EOB from insurance should tell the same story. If they don't, someone made a mistake, and it's probably not in your favor. Step 4. Appeal denials instead of accepting defeat. If insurance denies a claim, don't just accept it. Ask your doctor's office to write a letter of medical necessity explaining why you needed that treatment. Many denials get overturned on the first appeal, but most people never try. They assume the decision is final. It's not. Insurance companies count on you giving up. Step 5. Negotiate and ask about cash prices. If you're uninsured or facing a massive out-of-pocket bill, call the billing department. Ask for a payment plan or a discount. Sometimes paying cash up front is actually cheaper than using insurance, especially for labs and imaging. You skip the markup they add when billing through insurance. It sounds backwards, but it's real. The system is so broken that having insurance sometimes costs you more. This matters because you can follow every rule and still get punished. You went to the right hospital, you saw the right doctor, you asked the right questions up front, and the system still found 17 different ways to stick you with a bill that makes no sense. That's not paranoia. That's not you being bad with money. That's how it works. The lack of transparency isn't a bug, it's a feature. The confusion is profitable. The more you don't understand, the less likely you are to fight back. But now you know the game. You know the 3 prices hiding in every service. You know the 5 traps that turn estimates into surprise bills. And you know exactly what to ask for when the next bill shows up. Every medical service has a fake sticker price, a secret negotiated rate, and your share based on deductible rules. Out-of-network doctors hide inside in-network hospitals. Facility fees appear when buildings change ownership. Observation status costs more than admission. Coding changes inflate bills behind your back. Prior authorization fails without warning. Your deductible resets every January. Get itemized bills. Request CPT codes. Compare bills to EOBs. Appeal denials. Negotiate every chance you get. The system profits from your confusion, but you just became a lot harder to confuse. So here's my question. What's the most absurd medical charge you've ever seen on a bill? Was it the $50 Band-Aid, the $200 aspirin, or something even more ridiculous? Drop your story in the comments because we're all in this together.